Hi, I'm Dr. Sam Sunshine. I want to welcome everybody. We are live on Facebook, and today I have the privilege of interviewing somebody that I'm very excited about. This is Michelle Dinsdale. I've known Michelle for years, and we've done a couple triathlons together, and she's a very big person in the community here in Foothill Ranch in Orange County. And if you happen to be listening live, if you don't mind typing in your name and what city you're from, that would be great. And then we're going to answer questions at the end. But today's episode or podcast is really about learning what health coaches, who they are and what they do. And so again, with Michelle, I'm going to give her a little bit of time to explain her education as a health coach and some of her experiences with her clients. So Michelle, again, thank you so much for being here.
Thank you so much.
It's really an honor to have you. And so tell me, what inspired you to become a health coach?
I have always had a desire to help people. And I think when I look back through my life, I grew up dancing. I was trained as a classical dancer and then studied dance education purely because I wanted others to feel the joy of movement and to nurture a life for movement. And with that came an interest in health and nutrition because we knew that in order to be a successful dancer, you needed to be very, very healthy. And so that developed a lot of curiosity in me. What did it take to be healthy? And so I delved into nutrition. I was very interested in anatomy and physiology and realized very quickly that if we're eating well, we're going to feel great. And that carried on for the most part during my teaching career. And then I gave birth to triplets, and my daughter was diagnosed with very high functioning cerebral palsy. And I found out very, very quickly that I needed to advocate for her in a system which I found to be very much a cookie cutter approach, meaning if you have this diagnosis, this is what we do, A, B, and C. I realized that my daughter was unique, as is every child. And as a parent, I needed to advocate. So I had to start researching. And very quickly realized there's always something we can do to improve a situation. And then my son was diagnosed with bipolar disorder, and I had to advocate for him as well. And I just realized very quickly, wow, I can help people navigate a journey full of challenges in health to find the best outcome for them. And it's been a really fantastic journey, helping people find solutions in all aspects of life, because we know that health doesn't just encompass the physical part, but it's also emotional and mental. And if we can just open ourselves up to accepting challenges and finding resilience in them, then I think we're going to find joy in life that comes with that.
So tell me, how long have you been a health coach for?
This is my 4th year. This has been my 4th year of health coaching.
And tell the listeners a little bit about the education required to become a health coach and where you did your training.
Right. So I did my training through the Health Coach Institute, and then busy completing a second certification with the Institute for Functional Health Coaching, which I really, really love because that really delves into the meat and bones of health coaching people with chronic conditions. I'm also a level 1 precision nutrition coach, so I can help people with their eating habits. And I think there's a much sought after need for that during the pandemic when people have been picking up a lot of weight during the COVID-15, as they say. And I think it's become a really important time for people to actually start questioning, what are we doing on a day-to-day basis? Is it helping our health? Are we building immunity, or are we actually taking away from it? Are we going to be better served to actually move forward in this pandemic and come out a lot better? And I believe that we can. I believe if we're actually listening to what the messages are, we have a lot of tools that we can use every single day to improve our immunities and our health in general.
Yeah. I agree. So we think a lot
alike. We do,
alike.
very much, yeah.
It's not so much pills and procedures, but lifestyle changes.
Exactly.
And the 4 lifestyle changes that we really focus on, I think health coaches share this with doctors who do more functional integrative medicine, is proper sleep, proper exercise, proper nutrition, and stress management. Mm-hmm. And then the 5th one could be community, being engaged.
Absolutely. And then I would add to that environmental factors as well. We're very affected by our environment, and also trauma, past trauma plays a huge effect in our health as much as we don't realize that it actually does. We develop some very self-limiting beliefs which stop us from actually moving forward to being completely healthy. So that's really interesting.
Those are great points, and certainly things we always need to
Address.
address and ask patients. With the current health system, where most people are in, as a patient, in a kind of like a Kaiser or a Hoag system, usually the doctors have such a short amount of time to spend with a patient, they don't really get a chance to get into their lifestyle, past traumas, how they were born, were they breastfed?
Exactly.
Super important questions that can dictate future health. Were they on antibiotics as an infant for a condition that can affect the microbiome and so forth? What are some of the types of patients you like that really are your avatar, the type of patients you'd like to work with?
I love, and I actually have an interview with potential clients, because sometimes people aren't always ready to address their health. They think they are, but I'm looking for motivated people who are willing to put health at the top of their priority list, because if we don't have good health, we actually don't have the capacity to do anything. We can't pursue dreams, we can't look after our families properly. There's just no way we can function optimally. So I look for people who are very motivated, people who are willing to work hard, because we know that the process isn't very linear. There are going to be a lot of failures. We're going to be picking up, and I look for, and I try and build this in my clients. I'm looking for a very resilient client, someone who is able to embrace the process and know that it is a process, that sometimes we need to just take very, very small steps. We can't build Rome in a day, as they say. And I think some people are of the belief that as soon as they start putting a day's work, they need to see a huge difference. And we need to realize that your body takes time to respond. As long as it took for you to become unhealthy, it takes just as much time to rebuild the health. But if we're doing one small positive thing a day, we're getting there. And it's understanding that, everyone is so different, and everybody comes from a different background, and our stresses are so different. And it's generally just looking for people who are willing to embrace the process. And as I said, who are putting health at the top of their list as a priority.
Yeah, those are great points. So touching on, you had some great points there. I know one of the hardest things for people is to change.
Yes.
And that's where I think health coaching really is beneficial. Maybe you can touch on that a little bit, about how you talked about baby steps, how you encourage people to make change, the things you do to implement lifestyle changes. Yeah.
So health coaching is, what we're doing is we're actually changing behavior, which lead to better health habits and health outcomes. And as I said, everybody is so different, and this is why it's such a wonderful journey, because what might apply to you might not apply to somebody else. So we're investigating, and I like to call it a journey of curiosity. We're not coming in from a judgmental point of view. What are you doing wrong? We're trying to see, why are you doing the things you're doing? Why is it not working for you? And what are the things we can do that work for you? How do you find movement that is safe and enjoyable for you? How do we find the right foods that work for you? Let's look at ways where we find fun in your life. How do you perceive stress? How are you living your life without a lot of the environmental toxins in your personal care products and in your house, which is all affecting us, especially as women, and our endocrine systems? So health coaching is, if I look at it, I liken it to the pie chart. We're not just working at one piece of the pie or the whole pie. We have all these different sections, and it's addressing sleep, it's addressing stress, it's addressing nutrition. There's so many aspects that form the basis of good health, which lead to joy. And I think that's what we do more relevant as health coaches, is we actually just break those down into doable steps for you without the overwhelm. So we're pretty good about taking the overwhelm out of everything you have to do as a habit, because I know there's a wealth of information out there. And if we look at people who just can't lose weight, they're not losing weight because they don't know how. We have enough information on the web to show us how to eat healthily. But people typically begin an eating plan, and they do very well in the first 2 weeks, and then the honeymoon period is over, and then we find they typically rebound and they're back to square one. So as health coaches, we become investigators, and we try and, we go in and we try and see, where are you becoming stuck? And I think that's one of the relevant words I hear with my clients a lot of the times. They're becoming stuck. So we like to get in and figure out, where are you getting stuck, and what can we do to free that up and move you in a way that we're just taking a step forward and a little bit more towards the direction of good health.
So that's great. So a couple of things I also want to touch on that you've mentioned is that bio-individuality is really important. And I think that's where health coaches really understand that not everybody is the same. Everyone has a different background.
Right.
Everyone has different goals.
Absolutely.
And that you're working with them. I know one of the concerns is, as a health coach, like a drill sergeant,
No.
and somebody who's going to be yelling at you.
Absolutely, yeah.
So tell me a little bit about that.
So I tell my clients, I'm not dictating to you and I'm not telling you what to do. It is a relationship of being together and being on a journey of curiosity. So I like to call it, as I said, a journey of curiosity. We're really looking in as a team. And sometimes we work with physicians as well, which is really great because as a team, we can look in and see, did this work? No, it didn't. So what are we going to do to change it up? There's no judgment. It is purely just a journey to find out what can we do to bring you to that version that is the best you can possibly be, where you're feeling happy and healthy and you have joy and you're able to just embrace the pressures of life and not crumble under them. So we're definitely not coming to you as a drill sergeant and shouting at you to do X, Y, and Z and then punishing you if you don't do those things. It's a journey of curiosity, as I said. And if we walk into that together as a team, I find that's where we find the true beauty. It becomes this relationship where, we're in constant communication and we're finding out the things that work for you and the things that don't work for you. And then we tweak things around until we find what is the best solution for you. And everyone, as I said, is so different.
Yeah, so what's an average time frame that you might work with somebody?
So that depends. I find the most successful time to be working with patients and clients is 12 weeks, so 3 months, because we get to see a difference. That's enough time to see the difference in what we're actually doing. But I have had clients come to me who have also just wanted a once-off session to have a kind of quick look at what are we doing, what am I doing in my life and my lifestyle every day, and what can I improve. And so I do 1-hour consultations. I've done 8-week courses. The best time frame I find that works for people who are really serious and might be battling a chronic condition and we need to do the work is typically 3 months. And that's where we get time to actually build that relationship. And it's beautiful. Yeah.
That's great. So other things I want to maybe have you share with the audience is maybe an example of one of your wins with a client, kind of where you started with them, and then kind of journey. I love that word because it's not only a challenge of change, but it's this journey that people go on. And again, it doesn't have to be years, but a lot of times just pointing people in the right direction,
right.
Dispelling myths. But maybe you can share with the listeners, maybe a particular client that you had just a great success and some of the things you did to kind of shine a light on their path.
Okay, so one of the people who comes to mind is a woman who was actually going through chemotherapy for breast cancer. And she approached me and she said after her chemotherapy, she never ever wanted to go through this journey of cancer again. And she was confused because she knew she was probably not doing some things that were helping her and that might have led to a cancer diagnosis. And she just really wanted to sort of dissect her lifestyle and make sure she was doing all the right things. So we started off and we went into her pantry and we cleared out all the food she thought was healthy and found a couple of things that weren't so good for her, and we educated her and just showed her that these ingredients don't work well for you. Got her to embrace a whole foods diet, and then took her shopping, go to the grocery store, teach her how to shop, what to look for, what to avoid. And then we climbed into her cupboards and her cleaning, her sort of stockpile of cleaning ingredients, that she was cleaning the house with. And we found so many toxic cleaners. And I explained to her that all of these have an effect on our hormonal system. So we found some natural ways to actually replace those cleaners. And then we looked at her makeup, took out all the toxic makeup, explained to her about the chemicals in makeup and how they actually influence our endocrine system as well. And then just met with her every single week to give her encouragement and prompt her in the right direction. She had a lot of questions. I would say by the second month, she was really embracing the whole foods diet. And I think just knowing that she was making a positive change just gave her such empowerment in knowing that even though her cancer might recur some years down the line, she has actually implemented some really good strategies to try and reduce the risk again. And it was such a joy just watching her feeling, coming to me feeling so dejected because she thought she was doing all the right things, and then just empowering her with some information, which was, it's out there, but just leading her and guiding her through the process so she wasn't overwhelmed and she never felt like she had all this information and she didn't know what to do with it. It was such a joy leaving her at the end of that feeling as though there was something she could do to change the course of her ship of cancer in the right direction and to live a healthier lifestyle. We found some exercises that she could do that she ended up really enjoying. She was a runner, she hated it. And we explained, well, then why are you doing it? You need to find the kind of movement you enjoy. And if that's a yoga class for you, that's great. As long as you're moving, that is all good. And we addressed her sleep habits, her sleep hygiene. We investigated some reasons why she was staying in some toxic relationships and discussed the disadvantages of that. There were so many elements in her life that we investigated. Accuracy. We went in as a team again and said, okay, how can we change this up so that you're in a better place to embrace this journey? And what is your body telling you through this? What are some of the lessons we can learn? And instead of fearing it, how do we just embrace it and use it to our advantage? So that was such a fantastic sort of journey that I had with it. But I have to say, all my clients have been wonderful. There's been something we've learned from each other, and it's just so amazing to watch people walk out and feel so confident and empowered to take charge of their health and their life.
Yeah. I think that's a great story. And are you guys still in touch with
We
one
are,
another?
yes, and she's doing pretty well. Every now and again, she'll sort of come in and phone me with a question and say, can I take this? What do you think of this? And I've led her to some websites which actually tell her which personal care products are toxic and what she's avoiding, and she's done a really good job. So she's on her way. I feel like she's feeling a little bit more confident about her sort of future life from here on out.
Yeah, so just that story brings up so many ideas and thoughts, and what I say to patients as well, and how important it is to really integrate you, would be to have a health coach like you to help patients, because it's one thing when I say, get rid of the Teflon pans, get a water filter,
Right.
get rid of the cosmetics. Don't take things to the dry cleaners, and forgive me if you run a dry cleaning business, but those things are not healthy for us. They're carcinogenic.
Exactly.
A lot of times, and they cause disruption of the endocrine system.
That's right.
And nervous system.
I think you said it best a couple of years ago. Your frustration as someone who really wants to help people is having a patient come in and telling them what to do, and they walk out with a list of recommendations, and when they come back with their blood work 3 months later, nothing's changed. And as a physician, you so wish you could walk your patients through that process, but you don't have the time. So health coaches become that bridge between the doctor, the patient, and the outcome. I like to think of that. We're kind of just walking that journey as physicians would like to see their patients turn out, and we're leading and helping them to do that. So I think there's a real need in the community for health coaches, and I think it takes a lot of pressure off physicians, dietitians, psychologists, where you actually need someone who can walk your patient and your client through that process to get to a healthier outcome without having to phone them every day, touch in with them every day, which you don't have time for, and I know you wish you did because you're that kind of physician. But I think that's really important. Yeah.
So what else can I ask you? I know that you just touched on the fact that you like to work with different specialists. What are some of I know what I wanted to ask you is, you've been very successful in your career. What are some of the things that you think have made you as successful as you are?
I think every health coach brings a different life story, and that's what makes them so special. And I know a lot of us have been through experiences with our own health, which has kind of opened our eyes and made us realize there were things we were doing that didn't serve us very well, and we've had to go back and investigate why. My life experience has been so diverse. I've had a messy divorce, I've given birth to triplets, lost a child, had one diagnosed with cerebral palsy, another one with bipolar disorder. And, in the beginning, I thought those challenges were so overwhelming. But every single challenge has taught me something so beautiful, and it's taught me to actually keep my self-care at the top and my health at the top of the ladder. Because if I don't have that, I cannot serve my family and my children well. I have to have the energy. I have to be strong for those children. And I think just developing the empathy through those life experiences with other people, being able to listen to them in a non-judgmental way, and just recognizing the pain that comes along with some of those experiences. I think I'm able to really connect well with a lot of people because people have been through so many life experiences. But I'm also of the opinion that we develop so much resilience and so much strength through those experiences if we're willing to just embrace it. And there's always a message, how can we use that for future good? How can we serve other people through our pain? I'm a huge believer in your greatest pain becomes your biggest ministry. And I find that in health coaching, where so many people are hurting because they're not feeling well or they've had traumas that have affected them and have stopped them from looking after themselves. I feel I've done a pretty good job about venturing forward and making myself a priority in all of that and realizing that, I'm actually really strong and I'm able to take on these challenges because I exercise and I eat well, and I've realized how much that has served me. So I think I'm able to relate those experiences to other clients in a way that they understand. I'm not coming from a place where, I eat well and nothing's ever happened. Life has just been great. I've had so many things happen in my life, and I think they've just opened the door to a journey with others that gives them a little bit more empathy and a lot of non-judgment.
That's great, Michelle. You just put things so well. I mean, this whole interview has just been great for me just to listen to the way you're phrasing everything, and it's so purposeful and again so necessary. Tell us a little bit about what a health coach is not, just so people know the distinction between what a health coach does and maybe what a health coach doesn't do.
So we're definitely not physicians. We definitely cannot diagnose a condition. We definitely cannot prescribe medications. We cannot prescribe special diets, meaning if you're diabetic, there's no way we can come in and give you a medicated diet. That is up to an RD. We are not psychologists or therapists. I think we're pretty good at recognizing when there is a need for that person, and we're very quick to refer. But we're coming to you from a place of someone with a life experience who's so interested in your life and the desire to make you feel the best you have ever felt. What is the best version we can create in you? We're not dictators, as I said. I have a personal training certification, so I'm able to train people if they need that, but some aren't, and so you're not allowed to prescribe an exercise prescription for most people if you're not a registered or a certified personal trainer. So it's very important to recognize that we work within our scope of practice. We're very quick to refer out if we feel the need to do that, but we need to stay on our tracks, and I think we're pretty good about doing that as health coaches.
It's so important to know that distinction.
Absolutely.
And then to enforce that with patients, because they maybe have expectations that maybe you're like, wait a minute.
And this is out of my directive.
That's out of my jurisdiction.
Exactly.
So if people want to get a hold of you, what's the best way?
So I have a website, michelleDinsdale.com, and there's a contact sheet there. You're welcome to fill that in. Email me at info@michelleDinsdale.com, and I'm happy to get back to you.
And if you were just to spell that out, just so in case,
all right.
2 L's, 1 L.
Michelle with 2 L's, and then D for David, INSDALE. Michelle Dinsdale.
Yeah, okay, great, .com.
Yeah.
Okay, so again, I'm Dr. Sunshine at OC Sports and Wellness. I do a family and sports medicine physician. I do utilize Michelle's services for some of my patients who really need the help to improve their health. And in this state of affairs with our health care system really failing us in many ways and health insurance costs going up, again, using a health coach, I think is a great use of funds to improve your health. It gets, straight to the heart of the matter, where people can really see, or you can shine light on areas that they're blind spots for most of us.
Right.
Sleeping 5 hours a night is not enough. Eating breakfast cereal with milk, not a good idea. Cooking with Teflon pans, whatever the case may be, you can point these things out that can really get people pointed in the right direction. So what I'd like to do next is just open up for questions if anybody has any questions. So far we just say here, great video from Pamela. Thank you so much. And we've got a question here from Sandy. No?
Oh,
No
that's
question.
my website.
Oh, that's your
that's
website.
the website. And then I just want to say, Dr. Sunshine, it's so good working with you because he is such an approachable physician. And one of the reasons I found him as a physician was he's just so easy to talk to. He never spoke down to me as a patient or ever does. I think Dr. Sunshine is really good about allying with you to find the best solution. I know there have been times where I've come in and I've had a thought about where I want to go. And Dr. Sunshine is so good about listening to that and embracing it and working with you to do that. So, and the fact that he's moved into more of a functional approach with his practice is really, really wonderful because we're both of the belief that there's root cause to everything. Something begins from somewhere, and we need to peel away those onion layers to find out where it starts. And if we can do that, then we can address a chronic health condition or a condition that much more effectively.
Yeah.
Yeah.
It's so true. And our health, our bodies are amazing. They said if our bodies were a computer, it'd be the most sophisticated computer. We have 1 trillion different reactions that are happening simultaneously every second.
Yeah.
And our body has an incredible ability to heal itself if you feed it the right stuff. That's information, food, sleep, and the body needs to be moved.
Yeah.
We need exercise. And I know we both believe in that. So again, do you customize your plans? Michelle, a question from Pamela. Thank you so much, Pamela.
Yes, Pamela, I do, absolutely. So depending on what you need, we have a talk beforehand and then we discuss it. And sometimes that changes during the course of the 3 months that I'm working with someone. But absolutely, it's not just, here's my template, I'm going to work with you and this is what I do. We definitely look at the areas of your life where you might need the most help, and that's where we actually work from. So it's very one-on-one, very customized to you and what you need, and from a place where your needs might be met the most.
Great question, thank you. So if anybody else has any other questions, otherwise we're going to wrap up today's podcast with Michelle Dinsdale, a certified health coach who's now getting your second certification.
Yep.
You're in the midst of that after being
finished.
certified.
Yep.
So it's like a second certification and an additional. So again, a very successful health coach right in our backyard. Take advantage of this. And again, with consultations, I don't know if those are complimentary.
Those are complimentary. So
Gosh,
I do we meet for a cup of coffee and we have a consultation, and it's just a chat to find out what are you looking to improve, what is your lifestyle, what are your concerns, where can I be of service to you. And it's a very friendly half an hour, and then we decide where we're moving off from there on out. But that's complimentary, yes. So
I'd like to thank our listeners for tuning in. We'll have more to come in the upcoming weeks. Stay safe. I know that the pandemic is still going on, but I know we're loosening the reins on restrictions. But I think it's still important to be safe, wear your mask, social distancing, frequent hand washing do make a difference. And we look forward to being with you again. I'm sure I'll have Michelle back on as a guest. We'll get to maybe some finer points and maybe some other areas that she focuses on. So stay tuned. Thank you again.
Thank you.
Look at that, right at 30 minutes.
It's amazing, just like that. Wow, you're getting good at this. Huh? Was it okay?
Oh, you were amazing.
The fact that my mom was fucking is actually me.
You asking those questions, that's awesome. I love it. Thank you.
That was so good, Michelle. That was amazing.
That is so cool. Thank you.
So they do talk about, I wonder if we're still alive.